Hi, everyone. If you're able to and would like to, please feel free to turn on your cameras now. We're going to get started in just a minute. Hello, it's good to see everyone. Good to see you, Lisa. Hi. All right. So I'm going to do the brief introduction that we generally do at the beginning of one of these Rural Health Equity chats. My name is Veronica, and I've been hosting these for a little while now in collaboration with the Health Equity Network. For those of you that are new, we're just going to run through what you can kind of expect from today's session. So let me just see if I can get this moving along. So as I said, my name is Veronica, and I am the founder of Rural Health Compass, which is a social enterprise working on the intersection of rural health and policy. And I'm also a rural family doctor working in Wales. And really the purpose of these rural health equity chats is to try and raise some awareness around what the rural health equity challenges are in the UK and beyond, and give us a bit of a space to discuss the different research and solutions happening within rural communities, and just to learn, share, and collaborate across sectors. So today's session, we'll start with this very brief introduction, and then I will hand it over to Lisa Westhorpe, who will be giving us our introductory presentation today to get us thinking about kind of sport and physical activity in the rural and coastal setting. After that, we'll move into the discussion, and we'll have about 35 minutes to do that, in which point everyone is welcome to kind of jump in, share what they're doing in their area, or just listen to what other participants are sharing. So to get a bit of an idea of who's in the room with us today, I'm going to try again to share a poll. Hopefully you'll all be able to see it. It's just going to ask you a little bit about kind of which area you're working in at the moment. So let me see if this works. You should be seeing the poll now. So please go ahead and just pick which one applies to you. I'd also welcome you to introduce yourselves a little bit in the chat if you'd like to. In previous chats, people have kind of shared LinkedIn's, emails, websites, the work that they're doing, so please feel free to do that during the session today. All right, let's see how we're doing on this. All right, so from the answers coming in, we've got about 35% from the community voluntary sector, about 18% public health, about 29% health and social care, and 24% in academia. So we've got a bit of a spread of different people in the room today, which is great. All right. So second poll for today is asking you a little bit about today's topic. So I'd like to know what you see as being the barriers to accessing sport and physical education in rural and coastal communities, and just pop in any words that come to mind, and then that should give us a little bit of a word cloud. So I'll give you a few minutes to think about that. And then we've got some other things around accessibility, lack of facilities, funding money, this kind of thing. All right. Thank you very much. So I'm going to hand over to Lisa Westhorpe now, and Lisa is an occupational therapist and the national lead for Sports Confidence CIC. So Lisa, I'm going to stop sharing my screen and let you put up your presentation. Please go ahead.
Thanks so much, Veronica, and thank you for inviting me today. I'll just do the tech bit where I try and share my screen, and you can tell me if I've got that right. Let's have a look. Just having a think about it. Can everybody see?
Yeah, we can
slides?
see that.
Fabulous. Excellent. So yes, so as Veronica said, I'm an occupational therapist and national lead at Sport for Confidence. We're a small community interest company based in the southeast of England. I actually live and work though from Northumberland, which is in the northeast of England. So I'll tell you a little bit more today about the work we do in terms of physical activity in reducing health inequalities, but also my own kind of personal perspective as somebody with kind of lived experience of living in rural and coastal areas. So let's move on. There we go. So as I said before, I work at Sport for Confidence, and I have done for about 2.5 years now. In various roles, leading up to the national work that we're doing at the moment. So we're a very small national team who share the work that we're doing in the southeast of England on a more national level. And that is actually part of our Sport England partnership that we have, a system partnership where we're given some money basically to share the work that we're doing throughout the system and connect up the system in terms of health and social care and the sport and leisure industry. In case people aren't aware of occupational therapists, because we are kind of a bit of a hidden profession, occupational therapists support people to do what occupies them. So it's not around occupation as in people's job. It's about anything meaningful to you. So that can be really broad. And I really like the fact that occupational therapy is really broad. I've worked in a lot of different areas of practice and in a lot of different geographical locations as well. So I've worked across physical health settings, within kind of private residential care settings for people with quite complex needs. I also worked over in the States for a few years as a school-based occupational therapist. I've set up a business around maternal health and supporting that transition to motherhood. And I now work more in terms of supporting physical activity from a public health perspective. I think all the different roles that I've done and all of the different areas that I've worked in have always had that kind of wanting to promote health perspective, though, and very much let's keep people well if we can, rather than that let's rehabilitate them once they're not so well. So my own, as we call it, occupational profile, so what matters to me, I'm a mum of 2 young daughters, I'm an occupational therapist, and I also engage in physical activity through netball, and I'll call it cold water swimming. It's more kind of throwing myself in the North Sea and then going for a bit of cake and a coffee afterwards. So I like to keep active if I can, but yeah, it's more the social aspect, I would say, for myself. So why are we talking about physical activity today? Why is it important? I think it is important for us maybe to run through some of the stats and really see what an issue it is. So unfortunately, most adults, or quite a lot of adults and adolescents, don't meet the World Health Organization recommendations on physical activity. And this is particularly prevalent in what we would call marginalised populations. So those furthest away from physical activity, as we like to call it at Sport for Confidence. Obviously, physical inactivity isn't the best thing for you, and it is detrimental to people at an individual level, but also thinking about that system-wide level as well. So it is responsible for quite a lot of deaths within the UK and across the world, which I'm always surprised to say is the same as smoking, which, yeah, it always comes as a bit of a surprise to me that being physically inactive could have that much of an impact on your health. And it does unfortunately cost the UK quite a lot of money every year as well. So this is something that we do need to be thinking about and seeing how we can support people to be more physically active and what that can look like in different communities, and supporting communities themselves to lead that. I always like to put this diagram up. So this is an Ishikawa diagram, so the fishbone model, thinking about what leads into being physically inactive. And as occupational therapists, we're thinking quite holistically about what the aspects are that can lead to physical inactivity. So we think about the person and the aspects around the person, but also thinking about their environment and their occupation, as we call it, so meaningful activities. So this diagram, I like to include it just because it shows the breadth of barriers potentially that people could experience. And I know, you know, the poll that Veronica did at the start, we really thought about some of these barriers, and some of those came up during that poll. So, you know, there are a lot of different things that play into physical inactivity in different communities. I'll also tell you a little bit about Sport for Confidence. So as I mentioned before, we're a community interest company and we started almost exactly 10 years ago now. We were founded by an occupational therapist who came from a learning disability community NHS setting. And she really wanted for occupational therapists to be working in a more preventative approach to supporting people's health rather than being embedded in very medical environments. So she teamed up with sports coaches and thought about how physical activity could be used therapeutically as an occupational therapist. So really thinking about how we promote access to and participation in physical activity. And our goal really is to reduce health inequalities, reduce the barriers to participation, and ultimately for people to be less inactive. And this just gives a little bit more information about Sport for Confidence. So I think I've said probably some of this already. Our traditional model is based in leisure centres. So we now have a tender through Essex County Council, which provides our leisure centre-based services for all leisure centres in all areas across Essex. So that's a real success for us, you know, going from starting in one leisure centre with one client and one occupational therapist to last year we had around 26,000 participant visits to our sessions in leisure centres. So it's expanded a lot through that time, which is really great to hear and see how we can kind of influence physical activity in communities. We do also have different provisions. So we have primary care provision, so working directly with GP surgeries to support access to healthcare services for those groups who are furthest away from both physical activity, but also from healthcare services as well. We also have things like our long COVID service, so supporting quite specific groups to access physical activity. And as part of the work that I do, so in terms of our national work, 3 years ago now we became a Sport England Systems partner, and that provides us some funding to share the work that we're doing on a local level in Essex, London and into Suffolk on a national level. And I've just included that diagram at the bottom just because I think this really shows where we're wanting to support people. So it's not about making people, you know, on the right of this graph who are already quite active to be more active. This is really supporting those people who lead really sedentary lifestyles and who don't have access to physical activity to do any more meaningful movement in their day. So I do have a short video that I was going to play. I'm going to stop sharing my screen and then reshare it. I'm not sure whether the link, let's see if the link will work. I'll give it a go. Can you guys see? Can you guys see that?
No.
No, okay. What I might do then is stop sharing my screen and then reshare. Okay. Interesting. There we go. So if I stop sharing, stop presenting, and then share my screen.
We can see the screen. There might be a question of whether the sound comes through though. Sometimes that doesn't work.
That's a good point. Let me just check. Let's come back over here again. And I want to stop sharing and just check the tab. Yes, you're right. I did not include sound. Let's try that again. Can everybody hear that?
Yes.
Sports of Confidence. It's my life because much good for me, controlling myself. Be yourself and be happy.
Sport for Confidence is somewhere you can be vulnerable. It gives you a reason to get up in the mornings. It's like a big family here.
Doctors and nurses said I would never walk, never run because I was multi-sport, don't need a walker and wheelchair anymore.
Our mission at Sport for Confidence is to provide an occupational therapy service to those that have a disability. I mean, I love what we do. I think it's really cool, and I feel that physical activity should be accessible for all.
We could be working with individuals who experience dementia, autism, mental health challenges, so anxiety, depression, social isolation. We have multi-sports, boccia, dance, seated exercise, curling. The list is endless. And we see hundreds of people across multiple delivery sites across Essex. What's special about us is that we have occupational therapists and sports coaches within the leisure centres. We're breaking down those barriers of them feeling apprehensive about coming into an area where they can engage in physical activity.
I mean, the impact is huge. We've seen such positive case studies of people coming through, accessing occupational therapy services at the right time and at the right place.
People that access our services, they are no longer isolated. It gives them a reason to get out of their homes. They meet new people, form new friendships. Their health and well-being improves, and it's amazing to see people more confident, more active, more energised, and just genuinely happy.
From where I was after surgery, I couldn't walk around the pool. Now I'm doing 8 levels this morning. Where would it be without Sport for Confidence? I really wouldn't like to say. It's something that's really changed my life. It really has.
Let me stop sharing that screen. There we go. So that just gives you a bit of a kind of snapshot into what Sport for Confidence kind of looks like on a day-to-day basis. So I have wrong thing. Let's come back again. Try again. So everyone can see the slides again, hopefully. Fabulous. Okay. So yeah, our aim basically is to create that kind of vision of somewhere where people can participate. It's tackling those inequalities so that everybody can be part of their community, can find somewhere that they belong. So it is around physical activity, but we want it to be broader than that. And we want it to be something that supports people's well-being, as well as just kind of checking boxes as to how much physical activity they're actually doing. So I do want to include a little bit about my own experience of kind of living and working in rural and coastal areas as well. So I actually grew up in rural Derbyshire, so I was about 10 miles away from the city of Derby, but out towards the Peak District. So that was really interesting to me, kind of growing up and knowing what that looks like from I think transport came up as an issue quite a lot in the poll, and again I would agree with that. It's not always the most accessible if you don't have a car. My first registered role as an occupational therapist was actually in a coastal area at Scarborough Hospital, and I would say I probably got my first role as a registered OT because of staffing shortages in coastal areas. So reflecting back on that, they probably wouldn't have taken a newly qualified OT. I did have experience in various different settings and services, but not as a registered member of staff. But they struggled to recruit to coastal areas. So that was my first experience as a locum occupational therapist at Scarborough Hospital. So again, seeing what that looked like. I grew up in rural Derbyshire, very far away from all of the coasts. But it was really interesting to see the difference of living and working at the coast and what that looked like in terms of healthcare services and the issues that sometimes brought up. So I do also have experience across different providers, but also in different kind of geographical areas. So at the moment, I live and work in Northumberland, but my experience covers a lot of different areas, and I've listed some of them as well. So mostly in England. I did live in the States for a bit and also in rural Wales as well. So I'm just going to kind of have a bit of a kind of detour into what occupational therapists might be looking at in terms of people's occupations, their meaningful day-to-day activities, and maybe what that looks like more in rural and coastal areas compared to other more urban areas. So I think you know, as we said earlier in the poll, there's more issues and emphasis around travel. You know, if we're thinking about people accessing work or anything that they want or need to do, really, longer commuting times, reduced access to public transport are also issues. Thinking about the differences in employment options as well, so more of kind of seasonal work. I definitely picked up on that living and working in Scarborough. That was definitely the first time that I'd ever lived in kind of a holiday destination, and planning discharges for people who'd come on, you know, a day trip on a coach and then having to take them hundreds of miles back to where they lived, and trying to plan a discharge, hospital discharge for that. So thinking about, you know, wonderful outdoor spaces, but is there a bit of a downside to that in that you might have to travel to it, you might have to have time to be able to use it, and also thinking about appropriate housing. So a lot of occupational therapists might work in social care, adult social care, and thinking about, you know, do we need to modify housing to make it appropriate for people? That was something that when I worked in Gloucestershire, that was a big issue around appropriate housing and people's needs. And I know in a lot of kind of rural and coastal areas that can be an issue. So yeah, thinking about access to services as well, and also kind of reduced connectivity and digital services, which we're coming to rely more and more on as well. I do want to just highlight some of the really recent data that's come out from Sport England. They do an Active Lives survey every year, and I quite like this map that's put up. It is very obviously England centric because it's Sport England, so apologies for those of us who are living and working outside of England, but I just think it's really interesting to see where the concentration of people who are least active are living, and it does tend to be more in those coastal areas. But there is very much a disparity, because if you're thinking about like North Yorkshire, which is a very rural area and has some coastline as well, that's actually doing quite well in terms of physical activity. So it's almost, it is based around rural and coastal areas, but also thinking about kind of economic issues as well. So I just think it's a really interesting like map to have a look at, and to think about who is less likely to be physically active, and it tends to be people who have a disability or a long-term health condition. There's been actually very little movement over the time that Sport England's been tracking this data in how active people with disabilities and long-term health conditions are, which is not a great thing, and they should be trying to really close that gap if we can. Also thinking about different socioeconomic groups. So if you're in a lower socioeconomic group, you are more likely to be less physically active. If you're an older adult, and also thinking about characteristics of inequality and how those build if you've got more than one characteristic of inequality. So as I looked at these statistics and reviewed the most recent survey, it did occur to me that maybe some of these groups that we're talking about in these bullet points do maybe tend to live more in rural and coastal areas, those kind of demographic groups. So that was really interesting for me to kind of think about in terms of my own perspectives as a healthcare professional, but also thinking about the wider work that we do on a national level as well. And I wanted to also highlight Sport England have some place expansions that were announced earlier this year. And I've listed, so this isn't a comprehensive list, this is some of the areas that I thought most aligned with kind of rural and coastal areas from that list. There is a full list available, and I'll put that in the chat later so you can find out a little bit more about, I think they announced 53 areas to begin with, so I've just pulled out some of the ones that I think are probably most relevant to this group. And if you do happen to be in any of these areas and want to know more about this, have a look at your local active partnership. So there's, I think it's 43 active partnerships across England, which correspond to geographical areas. So you can search for those online, and they will be coordinating this new kind of place expansion, which will involve some funding. I think they're trying to do it so that it's more of a system-wide approach. So it's not funding, for example, specific roles or sessions that people might put on. It's more about working with the wider system to be able to support physical activity across a whole systems approach. But definitely do contact your local active partnership if that's something that you're interested in, getting physical activity maybe more into the services that you're working with. I've just listed a few kind of useful resources here as well. Uniting the Movement is Sport England's 10-year strategy to increase physical activity, reduce physical inactivity, and reduce health inequalities. So a lot of this really aligns with the work that we're doing at Sport for Confidence, and hence we were chosen as a system partner to be able to support them to meet the goals around uniting the movement. It's very community focused, and thinking about how we can support communities to be as active as possible, and for them to drive that, rather than it being people parachute in, provide services and then leave at the end of their funding period. We've also got the Movement Fund that Sport England has as well. So we actually supported a leisure centre in Darlington to apply to the Movement Fund through a student placement that we had. And we got some funding for a boccia group for people with learning disabilities. So that was really great to see how that could support kind of reducing health inequalities in that population. And we also, as Sport for Confidence, also have some free resource on our website. So I'll share the links to these in the chat as well. So we have some inclusive sports guides that are available for free, and various different videos on our YouTube channel and things like that. So there's quite a lot of different resources that we can support people to learn about reducing health inequalities and physical activity. So that's the end of my slides. I feel like I've been talking at you a lot, so I'm going to stop sharing so I can see you all again. Thank you all for listening.
Thank you very much, Lisa. And I'd like to just welcome anyone who has any questions for Lisa to go ahead and ask their question.